Hi, this is Dr. Gas Pasha here. Today we'll have a continuation of the video which we discussed about the extraction, the post-extraction instructions. So, few were left out, or you can say where the indications were left out. For example, can be extraction done in alcoholic cases, or can it be done in the smoker cases? And what about the systemic conditions like pregnancy and cardiac patients or any other medically compromised cases? Today we'll try to discuss some of them, and anything is left would be again followed up in the next video. So in particular, a patient who undergo extraction, he or she should not be an alcoholic. Now what is happening there in alcoholic is there is something called as pH. So most of them who have known about the pH, so there is acidic pH and alkaline pH. Now when the anesthesia is given, anesthesia which is a local anesthesia which is commonly used for extraction. So a person who is alcoholic or a chronic alcoholic, you have to be assessing this beforehand and make sure that you do not go for extraction one day before or the day before you had the alcoholic drinks. Second, what important is about the smoking. Now smoking, can a person do a smoking immediately after extraction? Here the concept comes is what is exactly smoking doing apart from what is going to affect on the lungs and the heart. What is it happening in the extraction or the post-extraction? In post-extraction, if you're smoking, the blood, as we know, it's warm. It needs some time to get clotting. So body has got a lot of clotting factors and starts getting clotting, and there is a huge cascade of inflammation or the process happening. Now, in post-operative or post-extraction, whether it is implants or the tooth removal, the instructions remain same. In fact, in implant, it is completely not advisable to be a smoker and then going for an implant. Of course, the patient will start losing the implants. The second here, why you should also not take the smoking into the consideration is the heat, what I was just continuing, the heat that is generated with the smoking results in the dissolving of the clot. And once the clot gets dissolved, so there is again leads to something called as dry socket, which we discussed in the previous video. Now coming to the pregnancy and cardiac, it's a big huge things to be discussed, but today I'm going to give you a very few important whether it can be done during pregnancy and cardiac. Yes, during pregnancy you can do, provided assess the patient is comfortable, patient knows about the procedure, and the person accompanied the patient, as well as if a person is using the lasers, like as I do since more than 1.5 decades, so it is safe to remove. So pregnant ladies who are worried about this, I can share a lot of cases since it's a video, so we'll try to cut short. For more information, you can contact my number, that's 98458 24665. I repeat once again, 98458 24665. So here what is important is whether you are in first trimester, second or third. What matters is the patient concern. It is the patient which is suffering from the pain. It's not the other person who is accompanying or the doctor. So please put yourself into the shoes of a pregnant lady. So how does she bear the pain of a dental, where it is very severe, whether it is acute or chronic? So it can be done safely, of course in consultation, and of course, as I said, giving a comfort to the patient and explaining about the new technologies like laser and the magnetic mallet. One can easily and comfortably do the extractions. Coming back to the cardiac, there's always a controversy whether you use, you stop the blood thinners or not. It again depends. One should understand the blood thinners, and there's a big controversy. As I go to many of the lectures, I hear that there is always a controversy, same as during pregnancy cases. Some doctors, they suggest no need to stop. Some they say okay, you have to stop. and everybody has studied this under the schooling that you need to stop. Some says 3 days, some says 5 days, but you have to consider whether it is a simple root stems or the mobile teeth or the whatever it is, not a major case. Now what does it major case? That is when you want to open up the flap, whether it is upper or lower, you are doing some flap surgery with grafting, GTR, bone graft or PRP, PRF and so on and so. So there it's a consideration whether you have to do it or not. The second comes if you're doing with a simple root stems, simple root extraction of the tooth, you don't need to worry about this. You can go ahead with the normal and of course use the sutures, put the sutures to the patient and give a nice compression as well as the triple LT lasers. You can also do the socket sterilization and use as much as laser during incision if you really want to use a minor incision. So with this one can control the bleeding, post-operative infections and of course the answer for the pregnancy or cardiac patients. The more will come up in the next video. Thank you.